This short presentation has been produced by the Kent Integrated Domestic Abuse Service to enable frontline staff and volunteers to have an awareness of domestic abuse during COVID-19 lockdown. It's essential that we all have an awareness of people's needs for help and possible restrictions for them accessing services at this difficult time. Victims of domestic violence and abuse are rarely going to tell anybody what's going on in their world. A secret we can often keep for months, years, and sometimes decades. Measures announced over recent weeks to tackle coronavirus have seen our day-to-day lives drastically altered. And shocking statistics reveal that domestic abuse has surged since the lockdown. Many staff are working remotely, and educational settings have implemented dramatic changes to help reduce the spread of coronavirus, which means that we see nobody. Community volunteers, workers in food outlets, pharmacies, banks, and our neighbours are likely to be the ones with direct contact with us. So today, I want to tell you about the definition of domestic violence and abuse. What does it actually look like? What you might notice, how to ask us, our barriers to engagement, what victims want, advice you can give, and where to signpost us. The Home Office definition of domestic abuse is any incident or patterns of incidents of controlling, coercive or threatening behaviour, violence or abuse between those aged 16 or over who are or have been intimate partners or family members, regardless of their gender or sexuality. This can encompass, but is not limited to, the following types of abuse: psychological, physical, sexual, financial and emotional. Controlling behaviour is a range of acts designed to make a person subordinate and or dependent by isolating them from sources of support, exploiting their resources and capacities for personal gain, depriving them of the means needed for independence, resistance and escape, and regulating their everyday behaviour. And coercive behaviour is an act or pattern of acts of assault, threats, humiliation and intimidation or other abuse that is used to harm, punish or frighten their victims. This definition includes so-called honour-based violence, female genital mutilation and forced marriage, and is clear that victims are not confined to one gender or ethnic group. Domestic abuse can happen to anybody. Domestic violence and abuse accounts for 1/4 of all recorded crime in the UK. Contact is made with the police every 60 seconds. I've been speaking to you for just over 3 minutes. 3 people have already called the police. And remember, domestic violence is a secret. It's a hidden crime. How many other people have been victims of domestic abuse during those 3 minutes? Domestic violence and abuse is more likely to result in injury than any other type of violent crime, and those who are victimised are more likely to become repeat victims. 1 in 4 victims are female, and 1 in 6 victims are male. 2 women are murdered every week in England and Wales at the hands of partners or ex-partners. And high-profile murders result in domestic homicide reviews. Too many domestic homicide reviews. So what does domestic abuse look like? We've broken this down into sections, starting with coercion and control. And we know from the government definition that this is a range of acts designed to make us subordinate and dependent. Making and or carrying out threats to do something. At worst, threats to kill us. Threats to kill themselves. Threats to report us to statutory agencies such as social services. If we've been able to call the police, making us drop the charges. Or worse, involving us in illegal activity so that we can't call the police in the first place. Economic abuse. Preventing us from being employed. If we are, taking our money. Getting debts in our name that often we don't know that we've had, and being secretive around our family income. Imagine having to beg to be able to feed yourself and your children. Intimidation. Creating fear by using their body language. This is most often in a look that tells me that whatever I'm doing, I need to stop. Whoever I'm talking to, I need to find a way to stop having that conversation and go and stand by their side. Maybe it's a physical size or their ability that makes me fearful. But most often it's an action or a gesture that only I know, that often only I see. Sulking. Sulking is the thing that makes us tell you that we're walking on eggshells. 2 days of not being able to speak to anybody. 2 days of not knowing what's happening next. Of course we're going to walk on eggshells. Destroying property. Is that our property that's been destroyed? Is it their property that's been destroyed? Very often, though, it will be the big hole in the wall where the punch was aimed at our face and missed by millimetres and hit the wall. Abusing our pets or threatening to abuse our pets. Often the only people that we can talk to are our pets because they can keep our secrets. And watching them being abused is as bad for some of us as abusing our children. And displaying weapons and using weapons, a very effective way to control us. Emotional abuse. Constant emotional abuse and put downs. Shaming and humiliating us, sometimes in public, making us feel like we're worthless. Calling us names over and over and over again, sometimes names that others don't know is actually abusive to us. And playing mind games. Is there something that we didn't know that happened and they're convincing us we did? Is there something they're accusing us of doing that we simply didn't do? Undermining our decision making with criticism, which often happens within parenting. And of course, in honour-based violence, using control could involve other family members to make us fearful. And all of this just simply makes us feel guilty. Isolation. Either physical, social or emotional isolation is often used to facilitate power and control over someone. Isolation also reduces the opportunity for us to be rescued or escape from the abuse. It's likely to minimise our day-to-day activities, including even our ability to go to work or do our daily shop. It also will restrict our friendship groups. Are we likely to be isolated from our friends and family so that we have nowhere to go to for support? It's likely to restrict our access to social media. And while we may not be forced to never go out, we may not want to go out because of the consequences if we do. And the justification for this is very likely to be jealousy. And disability is often used to enhance that control. Children. Most parents feel some guilt about an aspect of their parenting, even if this is simply not enough time to play. Imagine the guilt you would feel as a victim of domestic abuse. Even after separation, the abuse can continue in the form of harassment relating to child contact. And for some, our worst nightmare of having our children taken and not returned to us. Children can take on many roles when living in a household where there is domestic abuse, and encouraging dominance in children is another tactic for us to endure. Stalking. Stalking is a pattern of persistent and unwanted attention that makes us feel pestered, scared, anxious or harassed. At worst, particularly after ending an abusive relationship, it can terrify us. Regularly receiving unwanted gifts. Receiving unwanted communication, sometimes very regularly within a day, 40, 50 phone calls and text messages. Messages passed via our friends or family or social media. Damage to our property. Repeatedly following us or spying on us. Somebody taking that much time to know where we are every minute of the day is psychologically terrifying. And of course, included with all of this will have been threats to harm us. Physical abuse and sexual abuse. Often both will involve beatings, kicking, burning, biting, stabbing. Injuries that can be permanent. Injuries that can cause our death. Safe Lives Insight tell us that 80% of victims are not visible to services. And of those, a quarter live with domestic abuse for 20 plus years. It's particularly important at this time that we all understand what domestic abuse looks like and where we can go to support those victims. So what might you notice? Somebody that's become quite withdrawn, often showing symptoms of depression. Someone with low self-confidence, blaming themselves for absolutely everything that is wrong with their world and often taking responsibilities for things that simply are not their responsibility. Someone has a sense of shame. Have you noticed injuries that don't seem consistent with the explanation? Technology use such as social media platforms being monitored at all times. A partner or family member that will not leave that person alone. Is that because they're caring and always want to be around? Or is it because they're fearful of what might be said? Negative coping strategies in a victim such as substance misuse, self-harm. Finances that are being controlled. Never any money to pay for things that are necessary in our day-to-day living. So how do you know if I'm a victim of domestic abuse? Ask me. But ask me in private, otherwise you could increase my risk. Normalise your question. Do you ask this question of everybody? Use non-judgmental tones of voice and language. If I feel like you're judging me, I'm never going to tell you my story. And if I do tell you details of what's happened to me, please ensure that you document the conversation, including any threats to hurt me, threats to kill me, threats to a child, any details that I give you of my assault. If there's any criminal damage, I may not be ready to talk to the police today, but I may be in the future, and this could help me. Offering to refer me on to specialist support is imperative. You don't have to support me as a victim of domestic abuse, but we are extremely lucky in Kent to have numerous services that will support me. So please get my consent and refer me on to those specialists that can offer me that much needed support. Really listen to the language that I'm using, as it's very likely that I'm going to minimise what has happened to me. Comments such as, it was only a slap. They didn't know what they were doing. It's not his or her fault. It's very likely that I'm going to tell you that it's my fault, or that it was just an argument. It doesn't happen very often that he or she can be really lovely and that we're okay most of the time. And there will be a list of excuses such as it was only stress, or it was because they'd had a drink or taken drugs that day. All of these things show you that I'm actually likely to be minimising what is happening in my world. There are many barriers to me accessing support. There are even more barriers for me ending an abusive relationship. Remember, it may not be a violent partner or ex-partner that I am leaving. It could be a family member, which means I'm likely to leave my whole family behind me. The biggest barrier, though, is fear. We know that most victims of domestic abuse are murdered at the point of leaving or having just left. That fear is what may keep me in this relationship. I'm also fearful of interventions from other agencies such as social services. Are you going to take my children away from me if I tell you about this? Maybe it's my mental health that's the barrier. Maybe today I just simply couldn't get out of bed, let alone pack my whole world in 2 bags and flee across the country. Maybe I told somebody about my domestic abuse before and they didn't believe me or they didn't help me. Why would I dare to tell anyone in the future? It's very likely that I blame myself. So another barrier would be my own guilt and embarrassment of the situation that I find myself in. In Kent, it should never be a lack of resources that prevent me from leaving an abusive situation. So what do I want? Firstly, I need to understand your confidentiality process. I'm going to share my innermost secrets with you. I therefore need to know who you're going to tell. I need you to listen to me. I need you to take the time to really listen to what I'm telling you, because it may have taken me years to pluck up the courage to be able to talk to anybody. And when I tell you, I need you to believe me. I need you to give me information of where to go, who to talk to, who to see. But more importantly, I need to be safe. So what advice can you give? Firstly, the government guidelines on isolation, which have been introduced as a result of coronavirus, do not apply if you need to leave your home to escape domestic abuse. And secondly, you need to give details of where we can access support. In Kent, the first place to call is victim support on 0808 16 89 111, where they will offer you a safety and support plan. This will include the offer of referrals on to additional services in your area, and they will be able to look at your needs and offer you support accordingly. You can access these services yourself on www.domesticabuseservices.org.uk. There are national organisations that can also offer you support. The Domestic Abuse Helpline on 0808 2000 24/7 will also be able to offer you safety planning and support and access to any available refuges in the country. Respect, which is for support of males, can be rung on 0808 802 4040, and Gallop, which is for specifically LGBT plus support, can be called on 0800 999 5428. The police continue to respond to emergency calls during the corona pandemic. If in immediate danger, you need to call 999 and ask for the police. If you're in danger and unable to talk on the phone, you can respond by coughing or tapping the handset. If you call from a mobile and dial 55 to make yourself heard, this will transfer your call automatically to the police. However, this only works on mobiles and does not allow police to track your location. If you call from a landline, if only background noise can be heard and BT operators cannot decide whether an emergency service is needed, then you will be connected to a police call handler, and information about your location should be automatically available to the call handler. So now you don't even need to speak to be able to access police support. If you are worried about the safety of a vulnerable adult, child or young person, you of course need to follow your own agency safeguarding processes. You can also use the Kent County Council website on www.kent.gov.uk and search how to report abuse. If you're concerned about an adult, you can call 03000 41 61 61. If you're concerned about a child, you can contact 03000 41 11 11. For an out-of-hours emergency, you can contact 03000 41 91 91, and you can email social services at social.services@kent.gov.uk. If you're an employer, it's really important to know that you may be the only person that keeps in contact with somebody during social isolation. Keep in regular contact with employees you know or fear may be facing abuse. Plan in advance with them what you will do if you lose contact with them and are concerned. If you believe there's an immediate risk of harm to someone, or it is an emergency, you should always call 999. Please also be aware of the services that are available to victims of domestic abuse and ensure that your employers are aware of how to access those services and that you will refer them with consent if required. Simply put, it's all about signposting to the right service. If someone is in immediate danger, please call police on 999 immediately or 101 for non-emergencies. To access specialist domestic abuse support in Kent and Medway, please call Victim Support on 08 08 16 89 111, who will triage and refer on to local support services. OneStop Shops are available across Kent and Medway. These are a free weekly drop-in where you can find lots of professionals under one roof. You'll be able to get advice about your situation here. During the coronavirus, OneStop Shops are still operating, however remotely. To find details of your OneStop Shop and all the other services in Kent and Medway that support victims of domestic abuse, use the county website and click on the districts to find your local provider. This can be accessed via www.domesticabuseservices.org.uk. For your information, we have attached Kent Police's latest poster giving details of support during COVID-19. We've also attached the Kent Integrated Domestic Abuse Services poster giving you brief details of everywhere across Kent that you can access support. You can also find support services across the UK at the government website. Remember, you do not have to provide support to victims of domestic abuse on your own. You simply have to tell us where to go to access that support. If you need advice and guidance on how best to support someone that you're supporting, any of the Kent agencies that have been mentioned in this presentation will be happy to support you. Thank you.